Hello, hello. We are live. We are live here and we are having Medical Monday. Welcome. I'm Dr. Frita and we're here to talk about the hot health topics in the news, and we have a plenty. So we're going to talk about Britney Spears. And let me just tell y'all, full disclosure, yes, I like me some Britney Spears. That girl can dance. She has hot songs. She's been through some things, as you know, including a conservatorship back in 2008. We went on the free Britney craze. And now it looks like she's having some issues. So we'll talk about her and we'll answer the question, is Britney Spears having a mental health crisis? And does she need to go back into a conservatorship? Or do they need to leave her alone, let her live, let her shave her head, let her dance with knives, let her, dance around in her bikinis on the pole, spend money? Is it a mental health crisis, or are we doing the most with Britney Spears? And then we'll talk about he whom we shall not mention. I can't stand saying this man's name, but the disgraced Hollywood mogul, Harvey Weinstein, if you would believe it, all of his convictions in New York have been overturned. Yes, the assault, SA, things that he was convicted for, as well as the R word that he was convicted for. Well, it's been overturned. And that 23-year sentence in New York, they say he can go home. But on his way home, he was actually admitted into the hospital. He was hospitalized for the many, 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 many health issues he has. So what we'll do is I'll turn your frown upside down, because instead of just focusing on him, we'll talk about some of the health issues he has and what to do about those issues. And we'll take that information so we can help you and your loved ones who may have some of the same diagnoses as Weinstein. And then we'll talk about, yes, updates. We have some updates on mammograms, breast cancer screening updates. You definitely don't want to miss this, because breast cancer is a leading cause of death among women. 1 in 8 women will have a diagnosis of breast cancer. So you definitely want to find out the update on the mammogram screening. And you know my favorite part, the live Q&A. Go ahead and write your questions down, because I will be answering your questions right here. We are live. I will answer your questions live and on stage. So stick with me. Don't go away. Like and subscribe as you come on in to Medical Monday. Come on back. All right, y'all, let's just jump right on in. I'm here to give you some evidence-based medicine, but you know I'm not doing it alone. I have my wonderful co-host and my practice manager, Shador. Come on up here, Shador. Let's get this thing going. How are you doing, Shador?
Doing well. How are you doing?
Doing very well, very well. The weekend was pretty good. How was yours? I hope it was restful.
Very much so. Very low-key.
Good. I love a low-key weekend. I can't say I really had one, because, Amara, my oldest daughter, is graduating from high school, and she had her senior prom this weekend. Now, let me talk about her for a second. I was begging her to go to prom because, Amara can be she dances to her own beat. She can be the cool kid, too cool for school. So she told me she was not going to prom, right? And I'm like, oh, you won't ever have this memory again. It's your senior prom. Beg the child all year. Like literally maybe a month before prom, she's like, Mom, can I go to prom? At the last minute. But I'm glad she did. She had a great time. And I did not cry that much. Okay, I did well, because, all roads have to lead back to me. But let's talk about some of the folks who aren't doing so well, okay? And we'll start with the disgraced producer, the disgraced Hollywood mogul, Harvey Weinstein. Let's go ahead and play that clip and then talk about why he got hospitalized, and we'll get into some of his medical issues. But before we do that, Shador, one of his many, many medical issues is diabetes. And so I want everyone out here in the chat, right after you finish liking this video, I want you to put a 1 if you have anyone in your family, which could include yourself, anyone in your family who has diabetes. That's one of his issues. All right, let's play the clip, please.
Harvey Weinstein is in the hospital. The one-time media mogul is still in custody, but he's been moved to a hospital in Manhattan. He was taken there Friday after his move from a state prison to a New York City jail. The 72-year-old was relocated after an appeals court on Thursday vacated his 2020 rape and sexual assault convictions. In a 4-3 ruling, the court found the trial judge incorrectly allowed testimony that was not directly related to the charges he faced. Prosecutors say they plan to retry him.
I feel overturning Harvey Weinstein's conviction was a terrible decision that sends an extremely disheartening message to victims of sexual assault everywhere. I will consider testifying again should there be another trial.
Weinstein remains in custody from a 2022 rape conviction in California. His lawyer says he is receiving tests at the hospital and that he needs, quote, a lot of help physically. Weinstein has been dealing with cardiac issues, diabetes, sleep apnea, and eye problems.
All right. When I tell you, when we first heard about this case, which I, was right around the Me Too movement where everyone started coming out and accusing him of just some unthinkable acts, right? Harvey Weinstein. You had people like Gwyneth Paltrow. You had Ashley Judd. You had people coming out and just describing the assaults. And over 80 women have accused him, but he was actually convicted for the 2 in New York. But apparently, something went wrong, and there was a technicality. And it just makes you think, if you have enough money and if your lawyers are good enough, boy, you can tap dance around certain things. But I'll leave that part of it to the laws in this country. But honest to goodness, the haves keep having. If you have a great lawyer, then even if 80 people, if credible witnesses are accusing you and have what at least the jury thought to be some pretty convincing evidence, then you can still be let go. So he's only 72 years old, this man, and I'm just going to tell you the truth. He cracked. He looks a mess, but he has diabetes. And I asked for those in the chat to please put a 1 if you have a family member, and it could include yourself, who has diabetes. Who's the first person in the chat today?
Yes, ma'am. First person in the chat today, Ronnie F. Good evening.
Hi, Ronnie F. Thank you for joining. Please make sure you like and you subscribe to this channel. We have over 700,000 subscribers on this Dr. Frita YouTube channel. Very proud of that. And we make sure we put out evidence-based videos. So you can think about just about any topic and a health topic, and we're probably going to have it on this channel. And if we don't, guess what? Leave a comment and we will certainly do our best to get it on there. All right. But does anyone in the chat have a family member with diabetes? Anyone put a 1 in the chat?
Yes, we have quite a few ones.
Okay, let's do some shout outs. Let's holler out some names on who put 1s in the chat.
Yes, let's shout out Randy Freeman. Hello.
Hi, Randy Freeman. How are you doing?
Layla Barnes.
Hi, Layla.
Miss Melissa.
Hi, Miss Melissa.
One more, why not? D. White.
Hello, D. White. All right. And I would have been surprised, Randy, Melissa, D. White, Miss Layla, if I didn't have 1s, because diabetes is definitely one of the more common illnesses that we have in this country. Over 30 million Americans have diabetes. Over 80 million have pre-diabetes. And so we'll chit chat a little bit about diabetes, but because I know we throw the word out, diabetes, or we say somebody has sugar. Oh, I got the sugar. Oh, my mama has sugar. But a lot of people don't really understand what diabetes is. And so what I'm going to do is literally I'm going to break down and explain diabetes, both type 1 and type 2. I don't know what kind he has, but let's just talk about, information that can help us. So I'll break down what diabetes is. And as I do, for those of you in the chat, I want you, if you know of any warning signs or symptoms of diabetes, like a symptom that someone could have that should be a clue that they should get checked for diabetes. If you know of any warning signs or symptoms of diabetes, write that out in the chat and then we'll address it. And then, if you have that symptom right or the warning sign right, then I'll actually go through the physiology just briefly on what it is. So diabetes, okay, again, it's very common. It is the number 1 cause of kidney failure in this country. Why do I care? Because I'm a board certified nephrologist, meaning I specialize in kidney disease and high blood pressure. And so the number one cause of people being on my dialysis machine having kidney failure is diabetes, which is very frustrating because it's something that's preventable in some cases, and certainly it's manageable. So here's the deal with diabetes. It's a nightmare because not only can it cause kidney failure, it can also cause heart disease, strokes, amputations, eye problems, retinopathy. Okay, it's a hot mess. So here's what diabetes is. People call it the sugar, and this is why. When you eat and your body has an elevated sugar, then what happens, or what should happen, is that your body should release insulin. And insulin is something that's produced in your pancreas, that little kind of drumstick shaped organ that sits right below your rib cage. That insulin acts like a key. Okay, so your insulin, just think of it as a bunch of keys. And what insulin does is it unlocks the door to your cells so that sugar can get in, because every cell in your body needs sugar. It needs sugar to have energy. Okay, so sugar can be a good thing. But here's what happens in diabetes. In some cases, people don't make enough insulin. So if you don't make enough insulin, you don't have enough keys to unlock the cells, right? You don't have enough keys to unlock the cells. And so if you can't unlock the cells because you don't have enough insulin, then what ends up happening is that you get hyperglycemia or high blood sugar, okay? And that tends to happen in diabetes type 1, or what used to be called juvenile diabetes. Their cells just don't make enough insulin. And so instead of the sugar getting in the cells, it stays in the bloodstream, and you have high blood sugar, which can be damaging and toxic to your body. But in some cases, your body actually does make enough insulin, okay? You have plenty of keys, you have keys galore, but your cells don't react to those keys, okay? Your cells are resistant to those keys. They're insulin resistant. So you can have all the keys in the world, all the insulin in the world, but if it doesn't unlock the cells to let the sugar in, then you still have high blood sugar. This is what happens in diabetes mellitus type 2, which is actually the more common one. 90% of the cases of diabetes are type 2, okay? So the type 1 diabetes, the juvenile one, is when your pancreas just doesn't make enough insulin, okay? That's the one that's juvenile, though adults can get that one also. But the more common one that people have is the type 2, where your body makes plenty of insulin, okay, but you're resistant to it. And there are different risk factors for diabetes. If you're a person living with obesity, that can be a risk factor if you have a family history. But that's just kind of the basic kind of definition of what diabetes is. Make sure that you go to my YouTube video right here on this channel, Dr. Frita, and you watch my video, Diabetes Explained, where I really go into a lot more details about what diabetes is. So you have a good understanding and you understand the blood sugar level, what hemoglobin A1C is. So check out that video after this live. All right. So let's talk about some of the warning signs and symptoms of diabetes. And symptoms are what you feel, signs are what you see. So Shador, is there anyone who stepped out here and guessed or gave a warning symptom or warning sign of diabetes?
Yes, absolutely. So
All right, let's see. Come to the front of the class. Who is this?
Mr. Bruce Davis.
Hi, Mr. Bruce Davis. What you got?
Mr. Bruce shares that he has diabetes type 2 and hypertension. So he says if they're tired all the time, could be a symptom.
Excellent. Fatigue, being tired all the time, can absolutely be a symptom. And I'm glad that you're here with us today because I hope that you're going and you're seeing your primary care doctor, and if need be, seeing an endocrinologist or a diabetes specialist. Sometimes the primary care doctors are able to, certainly at early stages, manage the diabetes just fine. But if yours gets to be a little bit complicated, you want to talk to your doctor about seeing an endocrinologist or a diabetes specialist. At any rate, fatigue is definitely one of the symptoms, and we'll talk about why. All right, thank you for that one. Who else stepped on up? Anyone else?
Mr. Ronnie is back. He says frequent urination, including thirst.
That's right. Let's talk about it, Mr. Ronnie. Let's talk about it, and then we're going to connect the symptom that you shared with this frequent urination with Mr. Bruce's on fatigue. Okay, so the frequent urination or polyuria occurs, and this is why, Mr. Ronnie, that this is a trip. So when you have elevated blood sugar, then what happens is your body's going to try to get rid of this sugar, right? And so the sugar is going to go through your urinary system. It's going to go to your bladder. It's going to be in your urine. Well, the sugar being there draws in water. So the more sugar you have in the urine, you're going to draw in more water. And so you're going to get rid of excess water while you're getting rid of the sugar. And that's another telltale sign. If someone does a urine dipstick, like they check your urine in the office, you might have positive glucose or sugar in the urine, which could be a warning sign of diabetes. So here's what happens. The more you urinate out the sugar in the water, you're going to get dehydrated, right? So what do? You're going to drink. So then in addition to having the polyuria, you're going to have polydipsia, meaning you're drinking. You're drinking, you're urinating, and you're actually becoming dehydrated because of the symptom of urinating too much. So here's the other thing that happens when you urinate a lot. You don't just urinate in the daytime because the blood sugar is high the whole time. So what happens? You get up at night and urinate also. You have nocturia. Now, I don't mean getting up 1 or 2 times at night. That's pretty normal. But you're getting up a lot to the point where it can disturb your sleep. So you have nocturia. So if you're already dehydrated and now you're not sleeping because you're getting up all night, then what happens? Going back to Mr. Bruce, you're tired all the time. You get fatigue. So, all right, y'all are spot on. Any more symptoms?
Yes, ma'am. Bountiful blessings.
Who is this?
Bountiful blessings.
Oh, I love it. Bountiful blessings. All right, what you got? What's your symptom?
Blurry vision.
You said it. Blurry vision absolutely is a symptom. Okay. So with the blurry vision, it can be for a couple of reasons. With all of this blood sugar, this water, you can get fluid shifts in the eye, which can alter your vision and give you blurry vision. If it's just because of fluid shifts within your eye, then that blurry vision can be temporary. But the high blood sugar, bountiful blessings, can actually be toxic to blood vessels in the eye, specifically the retina, okay? That's at the back of your eyeballs. And so then you can get a diabetic retinopathy because of blood sugar. And this certainly can lead to a more permanent blurry vision. So for people who have diabetes, you definitely, even if you don't have symptoms of any blurry vision yet, talk to your primary care doctor or your endocrinologist. And they probably already talked to you about it, but be your own advocate. Bring it up. Ask them about seeing an ophthalmologist to see if you have any signs of diabetic eye disease or diabetic retinopathy, because there are different procedures that can be done. The best thing is to maintain a normal blood sugar. So absolutely, that's right, blurry vision. That's another symptom. What else do we have? Y'all already got this thing.
Mr. Randy, very
Hi,
hungry.
Mr. Randy. What's that?
Very hungry.
Very hungry. Yes, very hungry. Mr. Randy, that's spot on. Because remember, I said that every cell in your body needs sugar. So with diabetes, yeah, you got high blood sugar, you have hyperglycemia, but because your insulin is not working, okay, your keys are not working to unlock the cells, or you don't have enough keys, either way, the sugar is not inside of your cells. The cells are hungry, right? They need the sugar for energy. And so if the sugar is not getting into the cells because you have hyperglycemia, where you're going to have low energy. So what are you going to do? You're going to eat. You're going to eat and you're going to eat and you're going to eat. But because the sugar is not getting into your cells to give you energy, guess what? Not only are you going to have low energy and keep being hungry, you're also going to have an unintentional weight loss. Okay. People who have uncontrolled diabetes will drop weight and it's not on purpose. And this is what's tricky. A lot of people, especially if they're living with being overweight or living with obesity, have maybe been trying for years to lose weight. And so sometimes I'll see patients in my clinic and I'll be like, you lost 10 pounds in the last month. Oh yeah, doc, looks like, I'm finally losing weight. Okay, what are you doing? Are you eating less? No, my appetite actually picked up. I go on and on with the questions. I start asking about, are you urinating a lot? Are you getting up at night to urinate? Do you have decreased energy? And of course, I check the blood sugar. I check the hemoglobin A1C. And a lot of times that being hungry all the time, eating more can be one of the symptoms of diabetes. All right. Let's see. Let's take a couple more symptoms and see what we get.
We have
that was a good one, Mr. Randy. What else?
D White.
Hi, D White.
Itchy legs.
Oh, you said it there. Y'all, honest to goodness, y'all are some sharp ones. Itchy legs. And that can be for different reasons. So now, D White, we already talked about how you're urinating a lot, right? You're losing water that way. So what happens if you're urinating a lot? You become dehydrated. If you become dehydrated, you can get dry skin. You get dry skin, it can be itchy. You can have itchy skin or pruritus. So you're absolutely dead on. Itchy skin can be one. Also, sometimes people can get some yeast infection just because your immune system can be compromised. And yeah, you can even get yeast on the skin, okay, in different places, especially places like folds. If you have folds in your skin, if your stomach folds over a little bit, for ladies under the breast, and you can get yeast there in kind of warm, moist places. And again, with the diabetes, your immune system can be compromised. We all have yeast, okay, everywhere. But if it grows to the point where it's becoming an issue, you can get itchy skin because of that. So that's another good one. I almost don't want to leave this topic.
I think
but we must.
one more.
Okay, let's do one more. Let's do one more. I love this. Thank y'all for participating. Again, please make sure you like this video, subscribe to our channel, and hit the notification bell. That way you'll be among the first to know anytime I release new videos. And hit that share button. Go ahead and share, copy link, send this to your friends. Tell a friend to tell a friend to tell a friend. We're having a good old time in here. We're doing evidence-based medicine. All right, we're gonna do one more.
Yes,
all right, one more.
Miss Pauline.
Hi, Miss Pauline.
Hi, she says numbness in legs and feet.
Numbness in legs and feet. That can be, yes, you are correct. And that can be for a couple of reasons. One, you can get poor circulation with diabetes, okay? And if you get poor circulation because of the blood sugar being toxic to your blood vessels, then you don't get the circulation that you need to your legs, your feet, or sometimes even your hands, okay? To your distal parts of your extremities, meaning the ones that are far away from your heart. And you can get a numbness or a tingling, and you can even be at increased risk for having gangrene or foot sores. The other thing that can happen is with the blood sugar being toxic to your nerves, you can get a diabetic neuropathy, which can also lead to a numbness, especially in the toes and in the fingers. And so again, you are dead on. Thank you. Oh, this is fun. This was almost like a game show, but it's not. It's Medical Monday, and this is Medicine in the News, talking about the hot health topics. All right. So if any of y'all have any more questions, we're going to move on to the next topic, but put them in the comments, because in addition to having diabetes, this man who just got all of his convictions in New York reversed, he also has reportedly obstructive sleep apnea. So if you have any questions on that, put it in the chat, and we'll do the live Q&A towards the end. I'll try to get to those questions. He also has some heart problems. He also reportedly has some eye problems. So if you have any questions about anything related to diabetes, heart disease, obstructive sleep apnea. Obstructive sleep apnea is a big one because a lot of people have it and they don't know that it can be life-threatening. Any questions on obstructive sleep apnea, put those in the chat, in the comments. We'll keep moving, but then I'm going to circle back, okay? All right. So now let's talk about the next thing. And this is so important, Shador, this next topic is so important. And I literally put on my pink, even though my favorite color is red now, but I put on pink because there have been updated mammogram guidelines, okay? Updated breast cancer screening guidelines. These were literally just released this past week by the United States Preventive Services Task Force. And it's very exciting because right after these results are released, they were released on a Tuesday, and I got called by News Nation to be able to go on their show, national news show, and talk about it. Y'all should check out News Nation. That's a show where Chris Cuomo is over there now, Dan Abrams, and it's actually a pretty balanced show because sometimes I agree, sometimes I don't, but it's not. It's pretty very close to the middle of the line as far as the political views. And I like it when I don't just sit there and always 100% agree with the show. But yeah, it's pretty cool. But anyway, but here's the thing. So there are updated guidelines, but when it comes to guidelines, you still want to make sure you consult with your physician, because the guidelines that are put out there for everyone may not be for you. In other words, if you are at high risk for breast cancer, these guidelines might not be strict enough for you. And so we'll talk about it. But first, let's play this clip briefly.
A group of medical advisors has updated the mammogram screening guidelines to start at the age of 40 instead of 50. The U.S. Preventative Task Force strongly recommends women ages 40 to 74 be screened every other year. Let's bring in Dr. Frita Fisher, a medical expert in nephrology medicine and pediatrics. Good morning, Doc. Thanks for joining us.
Good morning, Hannah.
So is this considered a win for women, updating the screening guidelines from 50 now to 40? There's a huge difference in that decade, as you well know.
There is a huge difference. It is a win, but we need to win more. So while the U.S. Preventive Services Task Force has previously in 2016 recommended the screening be between ages 50 to 74. Other societies like the American Cancer Society, the American Society of Radiology have already had their recommendations starting at age 40, because we know that, of course, breast cancer is a leading cause of death.
All right. So yes, these are brand new guidelines. The task force says that women should have breast cancer screenings, mammograms, starting at 40 and every other year. Now, a lot of you are probably thinking, hold on, my doctor already had me getting screened at 40. Okay. I want you to put a 2 in the chat if this guideline is groundbreaking to you, or if your doctor already recommended that you, or if you, or a loved one, if you already thought it was 40 before, and this is not really earth shattering. Put a 2 if you already thought the guideline was 40 and you're unmoved. Okay. Put a 3 if this is groundbreaking because your doctor told you 50. Because here's the thing. Back when they had previous guidelines, this U.S. Preventive Services Task Force, they were saying that you could wait till 50. Okay. And a lot of us in the medical community were screaming about that because we already felt that that would cause people to lose their lives. Specifically, the American Cancer Society already had people starting screening as early as the age of 40. And even earlier, if you have a close family relative who's had a breast cancer diagnosis at a young age. And then even like the American College of Radiology had already had people screening close to 40. And these other societies are saying every year as opposed to every other year. And I'll tell you, again, what I give here on this channel is informational. You definitely want to consult with your physician. What I give is medical information. Your physician will give you medical advice, but please hear me when I say that that advice of every other year is not for everyone. And I have always recommended that my patients start screening at least by the age of 40. This is why. We have learned that since 2015, the number of women being diagnosed with breast cancer in their 40s has increased by 2% each year. Okay. So these young women in their 40s, more and more are being diagnosed with breast cancer. Yet until last week, the U.S. Preventive Services Task Force was telling people, oh, it's okay to wait till 50. Okay. So that's the important thing about listening to guidelines. You hear the guidelines, but see your physician. Here's the other thing. If you are at high risk for breast cancer, those guidelines are probably not for you. They're not for you. So, excuse me. So say if you have a family member who was diagnosed with breast cancer at 45, a close family member, like a sister or a mother, a first degree relative. If that person was diagnosed at 45, your physician may recommend that you get your mammogram screening 10 years prior at 35. Consult with your physician. It depends on your risk. Also, if you have a strong family history and you test positive for BRCA1, then it's going to be earlier than the typical recommendation. And here's something that's very important. If you are a Black woman, then statistically speaking, you are more likely to be diagnosed with a more aggressive form of breast cancer. And Black women are 40% more likely to die from breast cancer than white women. This is according to the CDC. Black women are 40% more likely to die from breast cancer than white women. So if you're a Black woman, please do not, you never should have been, I recommend that the 50 really never would have been on your radar. But even that every other year screening, I would fight strongly to get every year, not every other year. So this is me speaking, kind of countering what the U.S. Preventive Task Force says, but go look up the American Cancer Society and they will be on the page, especially by the time you get to the mid 40s or like 45, every year. Okay, getting your mammograms. Also, if you have dense breasts, the FDA, this is something that's important. Just in this past year, okay, if you have dense breasts, then the typical 2D mammogram is not going to be as sensitive as picking up breast cancer as something like a 3D mammogram or maybe an ultrasound, depending on what your breasts are like. So a 3D mammogram is something that would be better for you than a 2D mammogram. Consult with your physician. But now, this is new, Shador. They just have it where when you get your breast evaluated by mammogram, they have to tell you about the density of your breast so you know your risk, okay? And a lot of Black women and a lot of women in their 40s have dense breasts. So those old-fashioned 2D mammograms are not necessarily going to work. Consult with your physicians. But anybody put a 2 in the chat saying this is no news for them? They already thought it was 40? Or is anybody?
Yeah, absolutely. A lot of twos.
Okay. All right.
Miss
All right.
Jacqueline.
Holla at me. Okay.
Miss
Good.
M,
Hi, Miss M.
Mr. John.
Hi, Mr. John. That's right. Don't let your loved ones sit up there wait until 50. Who else?
Caddy, 1975. She says 2 ever since I've been getting them.
Very
So
good.
she's known
Okay.
about it. Yeah.
Good.
And Veronica.
Hi, Miss Veronica. Yeah, so back when they changed their guidelines and they said 50, even though again, the American Cancer Society always was like 40 every year for some, starting in the 40s. I've always been afraid that someone would look at that and say, "Oh, I can wait till 50." And I've been even more afraid that insurance companies would deny people just based on what the U.S. Preventive Services Task Force said. But now at least they're on board by saying, let's start at age 40. They're saying every other year, but I'm hoping they can hear some of the voices, and especially if people in their 40s are having an increased amount of diagnosis. It's increasing by 2% every year since 2015 of people in their 40s being diagnosed with breast cancer. Hopefully there'll be a change in that. Y'all, I have videos on breast cancer again on this channel. So make sure that after you watch this live that you check out my videos on breast cancer explained. We talk about statistics and how 1 in 8 women will be diagnosed with breast cancer in a lifetime. Men can get breast cancer too. Okay, y'all know about Cowboy Carter? Her father, okay, Beyonce's father, Matthew Knowles, had a diagnosis of breast cancer, and he's been open with it. He shared it. We did a panel together, actually, on Rolling Out. We did a panel some years back, and he was sharing his diagnosis. And T-Boz was on that panel too. If you go to my playlist here in this YouTube channel of television appearances, then you should be able to find that conversation. But men can get breast cancer too. So you want to talk to your doctors. And also remember that statistic about Black women. Black women are 40% more likely to die from breast cancer than white women. Oh, and if you're listening to me and you think, breast cancer doesn't run in my family, I don't have a family history of breast cancer, I'm probably okay. 85% of the women who are diagnosed with breast cancer have no family history. Okay. So make sure you consult with your doctor. You get screened in the most aggressive, appropriate screening, and be your own advocate. Yeah. All right. And I'll be posting the whole interview that I did on News Nation. So you'll be able to see that on my Instagram. And if you put up my Instagram, Shador, then it's at dr.frita. On that, I do a lot of my real-time things that are going on, even things going on with my family. Like my daughter just got awarded a scholarship from my chapter, the Mary to Roswell Alumni Chapter, MRAC of Delta Sigma Theta Sorority Incorporated. And, my daughter's a senior in high school. They gave her and many other just wonderful, outstanding, deserving seniors some scholarships. Honey, they're trying to help us pay for school. Yes, I posted that on my Instagram. And so you can see me grinning and being proud. Child, Mara, you already know Shador. My daughter's low key. She gets tired of me. I don't care, honey. I be screaming and hollering and proud. But that's on my Instagram channel. But then I'll go ahead and post this as well. I post different television appearances, and you can catch some of them on here on my my YouTube channel as well. All right. So now let's talk about Britney Spears. Let's talk about Britney Spears. We'll cover her, and then we'll spend the rest of the time on the live Q&A. So for any of you all who had questions or comments about the other topics like the diabetes, obstructive sleep apnea, some of the heart disease, any kidney questions, high blood pressure questions, if you want to talk about breast cancer, go ahead and put those questions in your comments. We'll talk about Britney Spears. And listen, while you're sitting over there typing your questions, slide right on over, please, and tap that like button and subscribe. When you hit that like button, it really helps us. It lets YouTube know that we're here, that we're giving good quality, evidence-based information. And it helps you to tell a friend to come on over. So please share it. Make sure you subscribe, hit the notification button. All right. Britney Spears. So, oh my goodness. This is a YouTube live. I'm over here acting like I'm not going to be. Oh my God.
Oh my goodness.
I live. Okay. I'm sorry for that. All right. Child, I got to be dramatic with it. All right. So Britney Spears, y'all, I like Britney Spears back when she was doing the oops, I did it again, all of that. Y'all know I can't help myself but singing, but also like her song Toxic and all of that. I really thought she was just a wonderful superstar. She can really dance. I was like, oh, this girl can dance. And she always had fun songs. But we watched her in 2008 have what looked like a mental breakdown then, right? And I remember Dr. Phil, he made me mad actually when he talked to Britney Spears back kind of during those times. And he came out and he said that in his opinion, she had bipolar disorder. And that really upset me because I just didn't know if he was supposed to be her actual, mental health provider, or was he just someone interviewing her? But I always felt that in that fresh moment, it was a bit of a betrayal. Now, the fact that she has psychiatric issues and takes meds, that's out there. She's talked about it as well. But at that point, I was frustrated. So, she had gotten married to her husband at the time, Kevin Federline, one of her dancers. They had 2 sons together. Well, in 2008, she shaved her head famously. And she also lost custody of her children in the divorce. And she got a conservatorship, right, where her father took over. And just if we could play briefly that clip, this is going back in time, back in 2008, when she shaved her head. That was something that kind of opened everyone's eyes to be like, okay, she's not just acting out. Maybe something's not quite right. We have that clip.
Yeah, we're doing a shaved head clip.
Yeah, shaved head.
Yes, ma'am.
When you look back at the whole shaving of the head thing and all the rest of it, what provoked you to do that?
It was just a really bad time in my life. Like, I was going through so much artificial stuff with my kids and with Kevin and all that stuff at the time, and he just left me, and I was devastated. I just remember I did not want to be at home because, like, my babies represented home. People started thinking that I was doing drugs, and people thought that it was me, like, going crazy and stuff like that. But people shave their heads all the time, But I mean, I was going through a lot, but it was just kind of like me just feeling a form of a little bit of rebellion or feeling free or, shedding stuff that had happened. I have really good days and then I have bad days. Sometimes it's like too much. Nobody can deal with some of that stuff like that.
Yeah, and she did have a lot going on. So so that clip there showing her shaving her head, and she's just kind of saying how, people do that all the time, and she was kind of releasing all the things she was going through. But a move that drastic really did kind of open everyone's eyes that something was going on. And ultimately she did get diagnosed with a mental illness. And I'm not sure if what Dr. Phil said was the accurate one. I can say that she has exhibited behavior over the years that are consistent with what Dr. Phil said, which was bipolar, specifically bipolar 1 is these are the kinds of behaviors she's exhibited, but I'm not privy to her medical information. I don't know anything more than what's been released, to the general public. But put a 4 in the chat. I want y'all to put a 4 in the chat if any of y'all actually remember back when she shaved your head, if you remember real time when that happened. I know I do. If I had a chat, I'll put a 4 in it. Shador, who was the first person in the chat today?
Mr. Ronnie.
It was Mr. Ronnie. Hey, Mr. Ronnie. Okay. All right. So she had shaved her head back in 2008. She was on the conservatorship under her father, but then and it was a pretty strict conservatorship, right? They were in charge of making sure she took her meds. They were in charge of her performances. If she wanted to do a different set or change things around, she wasn't in charge of it. They were in charge of everything. Even they would, have guardianship on who she dated, when she dated, where she went. And so then there was like this big movement, I believe starting around 2017, where people were like, that's not right. Free Britney, free Britney. Okay. And so she petitioned to get her conservatorship removed, where she can have control of her own monies. Okay. Because that's another thing. They were in charge of the money. And so she moved to get freed from it. And in 2019, her father, who initially was over it, stepped down, and there was someone else who was over it. And that person still was in control of the people with whom Britney interacted. But ultimately, she got the whole conservatorship removed. And if you go to Britney Spears' Instagram, you'll see that she is on there a lot. And a lot of times she has, tiny little clothes on. She's spinning, she's dancing, she's on the pole, she's doing things, and you don't know. It's just a snapshot in time. So is she just being funny and free and that's her personality? Maybe. But there was another thing that happened, and this is more recently. This is after the conservatorship, where she was spinning around and dancing, but she had knives. And this actually led to a well visit, meaning healthcare professionals, after seeing the video of her with the knives, they went to her home to see if she was mentally well. Let's play that clip of Britney dancing with knives, initiating the well visit. All right, so she's dancing with the knives, and I guess she's trying to be provocative, but honey, she provoked herself right to a mental health visit where they went to check out and see if she was okay. Does anyone are there any fours in the chat? Does anyone remember back when she originally had that head shaving, when she shaved her head back in 2008?
Absolutely.
Okay, who we got? Holler at some names. Let's see what we got.
Yeah, we have Lynn Smith.
You remember Lynn? Me too.
Rosalind Washington.
Hi, Rosalind.
Harmony and Peace Tranquility.
Ooh, peace. Hi, Harmony. Yeah, she was not at peace when she did that back in 2008, nor did she have tranquility, honey.
Miss Keisha R.
Hi, Miss Keisha.
And Barbara Timmons.
Okay, how you doing, Barbara? Yeah, I remember that. It was really a sad moment. And while it does sound like her original conservatorship was very strict, it definitely did seem like she had some mental health issues. And that's not even allegedly at this point, you know, she shared it. But now, fast forward, she's dancing with knives. And I'm wondering, okay, if I were to do a video like that, now y'all know I do dance videos, but y'all won't catch me dancing with knives. I'm thinking there are a lot of people who could do it, and maybe you would just think they're being provocative. Put a 5 in the chat if you think that it was appropriate for them to do a mental health visit with her after seeing the video of her dancing with knives, or if you think, but put a 6 if they were doing too much. Okay, 6 if they need to quit. 5 if it was appropriate, specifically in Britney Spears' case, for them doing the mental health visit because she did that video with the knives. Put a 6 if you think they're messing with her, they're doing too much, because the context really matters. Yeah, anyone popping up any 5s or 6s? 5 if they did the right thing, 6 if they did too much.
Casey with a 5.
5 they did the right thing. Anybody else think they did the right thing?
Miss Pat D.
Miss Pat D say put them knives down. Okay.
Miss Ann Whitehurst.
Hi, Miss Ann Whitehurst. This is my auntie. This is my mama's little sister. Hi, Mrs. Ann Whitehurst. Yes, I agree. They're doing too much. And if anybody at our family reunion starts doing TikToks with knives, we're going to call it on them too. Okay, who else?
Oh my
Don't even try.
Rosalind.
Rosalind. Okay, so most of us think that they should have done the well child. And I agree, specifically because of her history. You have to put it in context. If she's someone who has had a mental break, possibly psychosis in the past, to the point where, you know, the judge felt that it was proper for her ex-husband to have the custody of the children. And just because your husband has custody of the children, that doesn't mean that you're mentally unstable. But in her case, that's what was cited. And if she's had this erratic behavior specifically for her, and if they're questioning whether or not she's taking her psychiatric meds, because she has been diagnosed with psychiatric meds, this is something that she has shared. Okay, so that's not allegedly. So I agree. Does anyone put a 6 and they think that they're doing too much and they just messing with Britney? Free Britney.
No one put a 6 yet, but Miss Monica, she did comment.
What you say, Miss Monica?
Said, no disrespect. My son took karate during tournaments, and some people did karate using knives and swords.
Okay. All right. So let's keep this comment up. So yeah. So that's what I'm talking about with context, right? It's all in context. So if you're doing it with karate, right, and it has a point or a purpose like that, Miss Monica, then no, I don't think that they should come down to the house and get your son. But if there's someone who very specifically has a history of erratic behavior and also a history of violent behavior. And again, I will say alleged for this, but allegedly with one of her boyfriends, or might have been her husband, her ex-husband, definitely a romantic partner, allegedly she would punch him and get erratic. That's something that was reported. Okay. And so if you have someone with violent behavior and a history of psychiatric illness that's not managed well, that's not taking medications, and now you see them with the knives, that's a whole different context. But no, I don't think that they should run around with everyone who's doing martial arts, or even people who aren't doing martial arts, but people who are dancing with knives, and maybe like what SZA. Ooh, don't let me lie on SZA. But she did that was it a Grammy performance? The Kill Bill one. And there was a whole lot going on with that, with some kind of violence going on. That definitely was theatrical. That definitely had a purpose. So I guess it all depends on the context. But yeah, I think that in her case, it was proper to do a well check. I don't mean go over there, lock her up, put her in an institution, but at least going over there to be sure that everything was okay. It's just kind of tough though. Once you have that highlight on you where you have had mental illness and it's not been managed properly and you've been a harm to yourself, it's difficult, because let's say she was just doing something that was theatrical and harmless. She really could have been, but I still think it's appropriate for them to do the wellness check to be sure. But yeah, but then you leave your son alone, Miss Monica. I'm with you on that one.
Well, Miss Melissa, she says we would request a conservatorship for you, Dr. Frita, if you started dancing with knives.
Well, you will not have that opportunity. You would not have that opportunity. Wait a minute. And then Melissa commented last week on Amanda Seales. That's a mess. Listen, go to my Instagram. I reposted that segment about when I was asking the questions about self-diagnosis and Amanda Seales. That's on my Instagram at dr.frita.
She said respectfully, of course. Yeah. No,
she's a mess.
Dr. Frita.
All right. So now let's bring it on up to 2024 and what's going on now with Miss Britney. It's Britney. And let's talk about it now, because now she's had another incident that's caused people to question her mental health. And now some folks are calling for her to have a conservatorship again. And I don't know. I'm just real sympathetic towards her, but I want her to be safe. I want her to be managed. But let's play that clip on what's going on now in 2024.
About what we're hearing now about Britney. Does this surprise you?
No, it doesn't surprise me at all, because the conservatorship was there for a reason. And even though, like you said, it might not have been, with the right person, the actual process needs to be in place, because when you have a mental illness to this degree, you need that kind of structure, supervision, and most importantly, to take your medication. And I think that's probably what's happened here. This is a no medication situation.
Why do you say that?
Well, because of the erratic behavior, the manicky spending of money, recklessness, destroying people around her. No one feels safe around her. No one can control her. She's out of control on many levels.
Doctor, so what is the answer then? How do you treat a patient that has those sort of issues?
Well, these kinds of situations run into a wall eventually. Either she'll hurt herself, she might hurt someone else, or she can be 51-50 because she's not being able to take care of herself. And any of those situations will push her to a place where medication can be given to her against her will.
You tell me if I'm wrong here. I don't see a world in which a judge would put Britney under another conservatorship because of the public outcry there was in the first case, whether it was misplaced or not. I just don't see that happening.
Well, I understand that. But at the end of the day, hopefully a judge would make the decision in the best interest of that patient. And if that's what she requires, even for a temporary amount of time, that's what she would require.
Doctor, is there any argument that could even be made that getting out from under the conservatorship was a horrible thing for Britney Spears, as we sit back and now obviously have watched what's happened?
Absolutely. Hindsight's 20/20, but look at it. She slowly is unraveling, and it was in place and she wasn't unraveling. She might not have been happy, but she was stable.
What would you do if you were taking care of Britney Spears? What would be the first thing you'd do today to get her help?
Medication. Put it in her. If she doesn't want to take it, I would inject it in her.
Wow, that's you were quick to answer that. There's no question in your mind.
Okay, let me just tell y'all. So, do I think that based on the incident, so this most recent incident, she was at a hotel and reportedly she had some screaming, some erratic behavior, and they called an ambulance there reportedly for a mental health check. And she refused to go. But now there are a lot of people who are saying that they're calling for her to have another conservatorship. Beyond what just recently happened, it's also been reported that she's been doing a lot of spending, and she's in her 60 million worth is dwindling down. Okay. And so she's doing a lot of erratic spending of money. And so people are saying that she's not taking her medications. I'm going to say alleged, but reportedly she's not taking her psychiatric medications. And so you heard that person in the interview say, get some medicine, put her in her. I'm going to tell you right now, I don't like how he presented himself at all. So while I agree that she should be evaluated to make sure that she's properly managed mentally. And maybe she does need some guidance for people to have to help protect her from herself financially in some capacity. That may be something that they find out. I think that she should be evaluated, but something about the way that man, I guess he was a doctor, the way he presented himself, talking about her, I don't think he's her doctor. I don't think he knows her, but something about him just felt very controlling, very misogynistic. Give her medicine, put it in her. Da, 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 da. I don't like how he presented himself at all. And if she does have a doctor, I hope it's not him. I don't like how he talked about her. And while I want her to be protected from herself, if she needs to be protected, I don't like the idea of someone just coming over here, almost like tackling her down, boom, control her, inject her. I don't like that. I do believe that there can be a happy medium. Again, I'm not her physician. I don't have privy to any of her medical information, but if she's in danger of being of harm to herself and others, then of course I want her to be managed, but I want her to have the freedoms that she can handle safely. I don't want the whole world to come in and bulldoze her just because they can. And just let me go ahead and push this a little further. I get frustrated because when you're dealing with people with mental health issues, they have to be in the hands of people who have their best interests and people whom are trustworthy. Because if she were a man who were completely out of control, I don't know if this doctor would say it the same way. I don't know if he actually is a misogynist and he's looking at her like a little lady who needs to be picked up and controlled. His delivery was all wrong to me. I want y'all to put a 7 in the chat if you agree with him. And I don't just mean agree in theory. I definitely agree that she needs to have an evaluation, if nothing else. But put a 7 if just based on what you've seen, put some medicine in her, go and get her. 7 if you agree with him. 8 if you think that there's some nuance to it. Yes, she should be managed, but don't just go in like a bulldozer and all of a sudden put her on a whole conservatorship. 7 if you agree with that man, agree with his delivery, if you're right on his side. And if you put a 7 in there, we're just going to talk in this live Q&A, but I like to hear opinions. So go ahead and put it in there. But as we get to some of the questions, I hope we have some questions, some comments, Shador. I do want to, I'll touch on the medical part of Britney Spears, which of course is the question, is she in a mental health crisis? Well, if indeed she does have bipolar, which again, I don't know for sure, but this is something that's been reported. So let's take her out of it and let's just talk about bipolar, okay? If she does have it, then what has been described in her behavior would be consistent with bipolar 1, okay? Bipolar 1, which we've discussed here before, and I definitely do have a YouTube video here on the Dr. Frita channel. So after you finish watching this live, you can go to that to get more information. But just briefly, a diagnosis of bipolar 1 would mean that a person has exhibited symptoms of depression. Okay, so some of those symptoms would be inability to feel pleasure or anhedonia, perhaps having sleep disturbance where you have insomnia and you can't go to sleep, or you have hypersomnolence where you're sleeping too much, where you have changes in the way you eat. Maybe you're eating more or you have no appetite and you just have these feelings of sadness that are lasting for weeks. Okay, so having some depression and then having at least one manic episode, okay? A manic episode where perhaps you have a flight of speech, you have tangential thought, you have pressure speech, you have keep going, you keep talking, you can't stop really. And you have what they used to call delusions of grandeur, where you feel like you can go out and you can conquer the world, even if it's not actually consistent with reality. If I tell you guys right now, I'm going to fly away and I'm going to become, you know, the queen of Nigeria, that's going to happen. It's going to happen tomorrow. I'm going to go and do it. Or if I tell you guys, I'm going to get up right now out of this chair and I'm going to join the WNBA right now at my big age. Plus, I never played for college, nor did I play for high school. But if I start saying these things and I believe them, you know, and if you are not requiring much sleep, okay, if you're in a manic episode, you might you can go, and you're getting very little sleep, but you feel like you can go. And with the mania, or full-blown mania, as they used to call it, you have this episode, and sometimes it can even lead to a psychosis where you have a break from reality. So if that's what she has, then indeed it would be important that she's managed. And reportedly, Britney Spears has not been taking her medications. Again, I don't know this. This is something that's been in the media. But if she's not taking it, then that means that she could potentially be a danger to herself. Because the other thing with people with unmanaged bipolar 1 disorder is that they have a higher risk of wanting to unalive themselves. That could happen eventually in someone who is unmanaged. And if you're listening to this, and if you've ever had thoughts of hurting yourself, please call or text 988. Call or text 988 if you're having some mental issues, or you feel like you're in a crisis, or having thoughts of hurting yourself. Call or text 988. Again, I don't know Britney Spears, not her doctor, but it would be important, if she has the diagnosis and she's unmanaged, for someone to step in and help her to keep her from being a harm to herself. But there are levels. It doesn't mean go, jump in, tackle her, put medicine in her. If she needs medicine, yes, but you have a conversation with her also. You don't just all of a sudden take away all of her freedoms, all of her rights, all of her money. That's how I feel about it. Free Britney, but protect Britney. All right, Shador. So let's get into some live Q&A. I hope y'all got some questions for me or some comments. Who has a 7? Let me see who got a 7 in this chat. Here we go.
Well, no one put a 7.
Okay. Now, y'all listen. Listen. Y'all can put a 7 if you want to, if you agree with him. I think we all agree that she needs some, help if she's a danger to herself or others. But I just didn't like his delivery, or the control that came out of his mouth. Child, please. Mm-hmm. All right, let's hit a few of these questions before we close out this room. And make sure y'all are liking this room. Just take that cursor, going over there. Hit the like button, please. That really does help our channel. It lets people know that we were here. Make sure you share it. Go and hit that share button. You can copy link, share. You could text it to your friends. Tell a friend to tell a friend. Tell them to come on in, because even if they've missed the live, they can catch us in the replay. All right, what questions do we have? Let's go for this live.
A couple comments in agreement with you. Miss Rosalind says, I agree with you about his approach 100. She did not agree.
Yeah, he rubbed me the wrong way, Miss Rosalind, the way he said it.
Yeah. And so JKL Pop says, I agree. The guy talking was just trouble.
Yeah, he couldn't be my doctor. Mm-hmm.
And Miss Pat D says, well said, Dr. Frita.
Hi, Miss Pat D. Yeah. And it is something. It just goes to show you can actually agree with someone, because it's not like I think he's completely wrong, that perhaps she needs some help, perhaps she needs medicine. But it's all about how you talk to people. And Shador, we get this a lot in the office. When people come for a second opinion, sometimes they'll tell me what the original kidney doctor said. And I'll be like, okay, yeah, I agree. Go. And I'll always tell them, I'll be like, I agree with every piece of this plan. And a lot of times the patients will still say, yeah, but I want to still change to you, because I like the way you explained it. So sometimes it's the messenger in that doctor-patient relationship, in that trust, and where it's not like the doctor is here and you're here. Yes, the doctor's information is here. We've trained for about 1 million years. And so, yes, we have certain knowledge, but the patient still knows him or herself. The patient still has to be a part of the plan for it to work. So it's not just this big maternalistic, paternalistic. It's the way you talk to a person. Honey, he couldn't talk to me like that. All right.
Yeah, Monica agrees. She says the doctor has no bedside manner. Miss Monica Hill.
Child, Miss Monica. And listen, Shador knows all we ever say is Shador. And y'all know Shador's been my practice manager for over a decade. So many of my patients, I'll be like, oh, Shador, we have the nicest patients. And we sit up there in the clinic, honestly. So anybody who's listening, any of my patients, listen, let me just shout you out. When y'all leave my office, Shador and I really have like a love fest, because we have the kindest patients. But sometimes I'll talk to my colleagues after the patients, I refer it to my colleagues, they'll see them and they'll be like, oh, well, she didn't like me, or she did it. And I'd be like, what? And all I can think is, you must not have known how to talk to her. And yes, I talk about my own colleagues. I'm like, if this sweet person told you off, you must have approached her in a condescending manner or try to talk over her head. So it's all about how you talk to people and how you treat people. If you want a patient to listen, then you need to listen to the patient And then y'all need to meet in a place. And of course, the patient needs to respect you and your knowledge, but you also have to respect the patient. Child. They don't teach that in medical school. My mama taught me that. Hey, mama. Hey, Dr. Inez. All right. What else we got?
All right. Oh, we have another comment regarding
Okay.
Britney Spears. Layla, she says, I'm glad the father has custody of their children.
Yeah, now I'm with you on that one, Layla. And of course, we don't know the ins and outs, but whatever was going on, and it was in that year 2008 when she shaved her head when the father was given custody of the children. So if she was not managed, which it sounds like she wasn't, then no, you definitely don't want the kids in harm's way. Now, I agree with that. Now, when it comes to kids, you definitely have to, if she's not protecting herself, we have to protect the kids. No, it doesn't make her a bad person. I'm not labeling her, but if she was unwell, it wouldn't be right to put the kids in danger. I'm with you on that one.
All right.
Yeah.
We're diving into the questions, shall we?
Yes, we shall.
All right. So, Mr. Call Me Troy, he wanted if you can do a video on CAD, coronary artery disease.
Coronary artery disease. Absolutely. Yeah. Absolutely. And let's see. And I'll tell you, the reason, Call Me Troy, this is so important is because heart disease is the #1 cause of death in this country. Okay, it's the #1 cause of death. And there's so many things that can put someone at risk for coronary artery disease. You can be at risk if you're living with obesity. You know, that's just kind of on the risk factor for a risk factor list for a lot of things. If you have high cholesterol, okay, specifically high bad cholesterol like LDL, that can put you at risk. If you're someone who leads a sedentary lifestyle, according to the American Heart Association, it's recommended that most adults exercise for at least 150 minutes, 150 of moderate exercise per week. Breaking it down, that's about 30 minutes. 5 times a week. But if you're someone who's not moving your body, that puts you at a higher risk. Even if you're stressed out. Anybody have stress? Hello. If you're stressed out and you're not managing your stress, that can put you at risk for heart disease. But definitely, and I'll tell you one, I'll do you one better, Call Me Troy. Once we're finished with this live, stick with me now. But once we're finished with this live, I want you to go to my channel. And like literally, you can go to the YouTube search bar, put in Dr. Frita, F-R-I-T, as in take care of yourself, A, and put in heart disease. And you'll see where I actually have some videos on congestive heart failure, on warning signs of heart disease, how to unclog your arteries naturally. So go ahead and check those out. And then if there's anything more specific, or maybe I'll do a short or a reel on some heart disease, but I definitely already have a little head start. But coronary artery disease, definitely the #1 cause of death in this country. So something you want to prevent. I also talk about different foods that can help to lower your blood pressure and can help increase vascular flow and help for your heart. So yeah, you're right on it for worrying about heart disease and making sure you do things that are preventive. Watch the videos and share the videos with the people you care about. Mm-hmm. Who else we got, Shador? Thank you.
Miss Layla.
Hey, Miss Layla.
What stage 5 kidney failure usually calls from?
Child. Now, y'all know I'm a kidney doctor. So this is what we do in the office. When Shador and I are not here, we're on the day job. And I'm a board certified nephrologist. So yes, I talk about kidney disease. There are 5 stages of kidney disease. #1, all the way through #5. #1 is the best, where you essentially have normal kidney function, but you might have something going on with your anatomy, like a backup of fluid or hydronephrosis, or you might have cysts, like polycystic kidney disease. But the worse the kidney function, then the higher the number. And CKD5 is when you've progressed to the point of being eligible for dialysis or a transplant. So the #1 cause of CKD is diabetes, which we touched on earlier in this live, which that disgraced Hollywood mogul has diabetes. That's the #1 cause of CKD and kidney failure. The #2 cause is high blood pressure or hypertension. Okay, so if you're asking what causes it, those are going to be the top 2 causes every time. And those are illnesses which do disproportionately affect Black people, Latino people. They disproportionately affect us. But the good thing is that these are illnesses that in some cases are preventable or certainly manageable. And right here on this channel, I spend a lot of time talking about the prevention of these top 2 causes, the diabetes and the high blood pressure. And right here in my book, come on book, Under Pressure, A Guide to Controlling High Blood Pressure, I definitely talk about ways to prevent and to manage high blood pressure. And if you click the link in my description, or even if you go to my IG page, I have a link in my bio on how to get this book where I talk about not only using medicines for blood pressure, but how to lower blood pressure naturally. I talk about using food as medicine, hydration, meditation, exercise, all of these things for lowering your blood pressure. Those are the top 2 causes. There are other causes as well. There are lupus can be a cause. Okay. The autoimmune disease lupus, where those antibodies, you know how your antibodies are supposed to just fight germs and bacteria, but in lupus, those antibodies turn on you and they fight you and they can fight your organs, including your kidneys. You can get lupus nephritis. Okay. So lupus can be a cause. There's also other things like FSG, focal segmental glomerulosclerosis, which is the most common glomerulonephritis among people of African descent. There's something called IgA nephropathy that can cause kidney disease as well. Even if you are someone who has frequent urinary tract infections, then or pyelonephritis, specifically infections of the kidney, that can lead to kidney disease. So all kinds of things can lead you down the road to CKD stage 5. But here's the key. Before you get any symptoms, before the doctor tells you, oh, you got CKD5, you want to make sure that you see your doctor for preventive health. Okay. You want to see your primary care physician because the routine blood tests that they do, specifically the BMP, basic metabolic panel, they check you for the kidney lab, the BUN, the creatinine, the eGFR, estimated glomerular filtration rate. So I tell you what, when you finish watching this live on stage, then I want you to please check out right here on this YouTube channel, my video on CKD stages. And I go into details from stage 1 all the way to CKD stage 5. I talk about the different symptoms that are common at each stage. Very importantly, we hit on ways to prevent CKD. On my channel, also check out my playlist on. So if you go to the playlist at the top and you go down to kidney health, I talk about ways to use food as medicine. I talk about the truth about kidney detox. I just released this month a video, I think it might have just been last week, on foods that can help you to repair your kidneys. And so, yes, sometimes medicines are the answer. Sometimes lifestyle is always going to be the answer. A lot of times both. It's integrative. So just make sure you check out this wealth of information and keep hanging with us every Monday. And we'll keep talking about kidney disease along with the health hot topics in the headlines. This is Medical Monday. Thank you for being here, Miss Lena. Thank you for your question.
Thank you, Miss Layla. All right. Layla. From Miss Reva Anderson.
Hello.
So I have high blood pressure, but most of the meds have magnesium in them, and I'm allergic.
What?
Today, other than controlled diet, what can I do to bring down my blood pressure?
Okay. So I must say again that what I'm sharing with you is information. It does not replace the advice of your physician. So my number one thing that I would tell you is to talk to your primary care doctor. And there's a few things, Ms. Reva. One, you want to make sure that you check, double check, cross-reference about those medications that have magnesium and find out if there are any formulations that don't have magnesium, because not all high blood pressure medications have magnesium. The other thing I would do, Ms. Reva, is I would request a consultation with an allergist, okay? With an allergist to confirm that what you have is a true allergy. And if it is a true allergy, I would find out if there are ways that you can be desensitized. In other words, are there certain treatments that you can have? Because magnesium is something that's quite important for us to have. And you know that when you look at your labs, it's important for your magnesium, really ideally to be greater than 2.0, certainly greater than 1.5, 1.7. We need magnesium, and it can sometimes help with having a normal digestive system. It can help us to relax blood vessels and have a lower blood pressure. And magnesium is kind of everywhere. It's pretty ubiquitous. It's definitely in nuts. And so a magnesium allergy is a big deal. So this is something that I would recommend that you talk to your primary care physician about, but also talk about seeing a doctor. Now, there are lots of things that you can do naturally, right, to lower blood pressure. One thing is eating certain fruits like papaya, fruits like citrus fruits are good for lowering blood pressure. Fruits like pineapples, they have bromelain, which is a powerful anti-inflammatory, can help to increase vascular flow. Eating ginger can help. Eating garlic. Garlic has a substance called allicin, which can help to relax your blood vessels so they dilate. And then beets. Beets, that's like my latest thing I'm enjoying juicing, beets. Beets have nitrates, which your body converts to nitric oxide. This helps to relax your blood vessels to help you with low blood pressure. Of course, having a low salt diet. According to the American Heart Association, most adults should be having less than 1,500 milligrams of sodium per day. So there's all kinds of things you can do naturally to help lower your blood pressure. But very importantly, with magnesium being something that's so important, I would want to make sure that it might take some extra steps, even go to the manufacturer and contacting the manufacturer, asking about the magnesium. But when you do it, preface it with saying, I have a magnesium allergy. That way they know to it's like a red alert to take you very seriously. You may even start with your local pharmacist and ask for the actual pharmacist, the PharmD, who's there. So not just the Pharm Tech, but the PharmD, who's got a doctorate in pharmacy, who's actually really studied the detailed chemistry and pathophysiology of how the medications work. All right, but what I'm giving you is information now. Going to your doctor for advice. Good luck to you, and thank you for being here today on this live.
Thank you, Ms. Reva. Next question, Mr. Calvin.
Hi, Mr. Calvin.
How do you stop edema pain if you have diabetes, kidney damage stage 3A, anemia, arthritis, frequent urination going on? What should I do after my doctor tells me I'm still doing fine? My A1C is 6.1.
Okay, so your A1C is 6.1. I imagine it may have been higher in the past. So if you didn't have a diagnosis of diabetes, and that will be in the pre-diabetes range, which means it's less than what it would have been to get you that diagnosis of diabetes, which would have been greater than 6.4. Boy, I just said a mouthful. So your doctor's telling you you're doing fine, basically, but you're still having more issues. One thing that's important for patients to do, and it's hard because a lot of doctors are on a tight schedule. You walk in, you feel like you're already being rushed as soon as you get in there, Mr. Calvin, and they'll start kind of turning for the door and saying, okay, everything looks good. And you're still sitting there with issues. But what I would do, sometimes it means you might have to do more than the typical visit. Instead of just having the doctor come in, talk, run down the list. Okay, you're doing fine. Let's go. When the doctor first says, hey, how are you doing? I will pull out my list and say, hey, I have these questions, A, B, C, and D, like some of the ones that you just listed here. Okay, so if you're having edema pain, then number one, you want to make sure that you find out from your doctor what you can do to decrease the edema. They definitely will recommend, and again, I'm giving information. This is not medical advice, but what I would recommend to my patients who have edema, definitely to have a low salt diet, like what we talked about. And also I would want to make sure they had good circulation, because sometimes when you have diabetes, your circulation can be affected. And so I might send them for a Doppler, like to look at the vessels to make sure they're open, or I might send them to a vascular surgeon to assess, to make sure they don't have any problems with their circulation, venous insufficiency, peripheral artery disease, that they don't have any problems with their lymphatic system, right? Lymphedema, like what Wendy Williams has. Y'all go check out. I did a whole series on what's going on with Wendy Williams, where I talked about her edema in her feet. So I would ask the doctor, instead of just saying, hey, you're doing fine, your hemoglobin A1C is fine, I'd be like, I got swelling in my feet. I want this evaluated. Should I see a vascular surgeon? Should we do a Doppler? Could I have lymphedema? So ask the questions, okay? And if you've already had the appointment, now you're back home, that's okay. Pick up the phone, leave a message for the doctor, or sometimes they'll have the nurse practitioner call you, but definitely ask the question to get that addressed. What else does he have in here, Shador, that's going on?
You mentioned arthritis.
So yeah, definitely some things that will help with arthritis. And this is general information. Again, this is not specific medical advice to you, but making sure you have a healthy weight, which is easier said than done. But if you're someone who's living with being overweight or living with being obese, that certainly is stress on the joints. But you also want to, again, consult with your doctor and see if you need to have an evaluation by an orthopedic doctor, an orthopedic surgeon, to see if you have osteoarthritis, okay, which is a pain in the joints that you can get from, instead of there being a nice space in the joints with all the good fluid in between and cartilage, some of your joints may have gotten to the point where you're starting to get bone on bone. So you want to find out intervention. The intervention is not always surgery. There's lots of conservative things that can be done first, but you don't want to live in pain, because if you have pain, that can potentially cause you to have worse than high blood pressure. High blood pressure, number 2 cause of kidney failure. So please don't just take it and live in pain. Also, if you're in a lot of pain, that might force you to take a lot of pain medicines, and certain pain medicines can be harmful to the kidney. So you don't want just to sit there and getting a Band-Aid of pain medicines. You want to go get to the bottom of it. But again, you must speak up. You must advocate for yourself. And even if that doctor's appointment is all over, honey, he's a phone call away, or she's a phone call away. I will call and mention it. What else you got? the CKD3A. So
Mhm.
at this point, if you've crossed the CKD3, then I would talk to your primary care doctor and ask about seeing a kidney doctor, because it is standard of care that by the time you hit CKD3, that you be evaluated at least once by a kidney doctor, a nephrologist. That's what I do, because what you want to do is make sure that you have all the tools to slow down the progression of kidney disease. And unlike eons ago, back when I was training, now we actually do have some medications that can help to slow down the progression of kidney disease, in addition, of course, to lifestyle management, making sure your diabetes is under control, making sure high blood pressure is under control, all of those things. So in short, you want to make sure that you go back, talk to your doctor, advocate for yourself, and you're onto it. You're really onto something when you say, doctor's telling me I'm fine, but I still got these things going on. Yes, ring the alarm, let the doctor know, okay, I'm glad my hemoglobin A1C is coming down, but that's not my only issue. So make sure you advocate for yourself, and good luck to you. And thank you for coming in today, Mr. Calvin.
Thank you, Mr. Calvin. Up next, Big Dude 88.
Ooh, Big Dude 88. What you got?
Can diabetes trigger anxiety? I'm 35. I've never had anxiety. I'm lost where it's coming from.
Can diabetes trigger anxiety? So it depends. If the diagnosis of diabetes to a young person who's 35, the very idea of having a chronic medical condition, which is what diabetes is, that in and of itself can be anxiety producing, right? And then certainly if you have experienced any of the symptoms that we talked about at the beginning of this live, if you've been thirsty a lot, if you've been having a lack of energy, if you've been urinating a lot, if you have different things going on with your body, and then now you're concerned, and now I'm sitting up here telling you that diabetes is the number one cause of kidney failure, poorly controlled diabetes, that could potentially be something that could provoke anxiety. But here is the key. Again, you want to talk to your physician. Make sure you have a primary care physician you trust, an internist, a family practitioner. If you feel like you're having anxiety, talk to that doctor, and perhaps even see a mental health specialist, a psychologist, or even a psychiatrist to make sure you find out if it's anxiety that you have. And you want to get to the core of what's causing the angst. And if it's the diabetes, then you want to do everything in your control to manage the diabetes and manage it properly. Sometimes I find, especially with my young patients, a lot of their peers are just running around here healthy with no problems at all. And so a lot of my young patients, Big Dude 88, aren't really interested in sitting here listening to all the lectures from doctors. But if you have that diagnosis, then ignoring it is not going to make it go away. Ignoring it is only going to cause you to have more of the complications, which would lead to even more anxiety. So what I recommend you do is go talk to your primary care doctor and be open and share that you're having anxiety, okay? Or you feel like you're having anxiety. Get it managed and tackle everything at the root. And to learn better how to control your diabetes, again, talk to your primary care doctor, talk to an endocrinologist, an endocrinologist or a diabetes specialist if that's warranted. And you can get some start right here on my channel, and go and look at my videos on Diabetes Explained, 7 early warning symptoms of diabetes, what added sugar does to your body. I have all kinds of information, and I just speak in a real, just a way that I hope is not anxiety provoking, where I just explain kind of what it is. And more importantly, I talk about what you can do about it. Okay. I try to be solutions oriented, and the more you can do to solve problems, you can't solve all of them, you can't correct all of them, but you have more power and more control in helping manage your diabetes than you think. And I think once you kind of gain control, manage some of the symptoms, that can help with anxiety. But thank you for being here today, Big Dude 88. And I want you to be well, and I want you to hop off the line and make sure you call your doctor, okay? All right. And I like that name, Big Dude 88. That's pretty cool.
All right, Miss Caddy.
Hi, Miss Caddy.
How bad is caffeine for your kidneys?
Ooh, okay. Do you know, Miss Caddy, that caffeine is the most widely used drug in the world? Yes, caffeine is a drug. Most widely used drug in the world. So here's the thing about caffeine. Now, people have a lot of vices, right? Some smoke cigarettes, boo. Some drink excessive alcohol, boo. Some do all kind of drugs, a little bit of pink cocaine. Y'all been watching this stuff with P. Diddy and all that mess. I hadn't even heard of pink cocaine. Anyway, I digress. So of all the vices, caffeine, I'm going to say for most people is not the worst. Caffeine is interesting because it's a drug that actually can stimulate your adenosine receptors. I won't get into it as much as I want to get into it because y'all know I want to break this thing all the way down to the pathophysiology of caffeine. But I will say this, you have certain receptors, adenosine receptors in your brain, your heart, and your kidneys. So when you have caffeine, what it does is it causes a certain stimulation that can cause your heart to beat fast, can cause your brain to be aroused. Okay, that's how caffeine keeps you awake. You drink caffeine to stay awake. You're up, you're moving, you're talking fast. And caffeine can cause you to urinate more frequently. Don't you notice that if you're drinking a lot of coffee or a lot of a soda that has caffeine, that you're up and running to the restroom? That's because caffeine can cause you to have an increased urination. Now, if you're having a lot of caffeinated beverages and you're urinating a lot and you're not going back and replacing that by drinking water, then ultimately the caffeine could potentially dehydrate you. If you're dehydrated, this could cause something called pre-renal azotemia, which is an acute kidney injury. So in other words, if you drink so much caffeine that you're dehydrating yourself, then it could cause a decrease in your kidney function. That doesn't mean for everybody to go and throw away your coffee. I'm not trying to put Starbucks out of business. I'm not trying to say don't get your little Dunkin' Donuts or hang out with your Keurig down to the house. What I'm saying is there's actually been studies, a lot of studies, and what has been found in general is that if you're taking in less than 400 milligrams of caffeine a day, then for most people, that's not going to be very problematic. Just make sure that you stay hydrated. Consult with your physician, because if you have something going on, like some type of a heart arrhythmia, abnormal heart rhythm, or if you already have a chronic dehydration or an advanced kidney disease, caffeine may not be right for you. But on average, if you're doing less than 400 milligrams of caffeine a day, so maybe 1, possibly 2 little 8-ounce cups of coffee a day, then likely you'll be okay. Okay. This is information though. Talk to your doctor, Miss Caddy. Thanks for the question. Oh, I got a video on it. Is caffeine bad for you? Right here on this channel. Check out the video and I go into detail. And then I really do break down all the pathophysiology and the chemistry of caffeine.
All right. A few more questions, a couple of shout outs, if I may.
Okay.
All right. Miss Renita.
Hi, Miss Renita.
What is your opinion of the diabetes drug Farxiga? It seems to have many unpleasant side effects. I'm reluctant to start taking it.
Okay, that is a good question. And the Farxiga is one of the drugs. And again, consult with your physician. But I'll tell you this, I do prescribe Farxiga in patients where I feel like it's indicated, because the studies are showing us that it is one of the few drugs that can help to slow down the progression of kidney disease. We don't have a lot of them. And yes, there are unpleasant side effects. I'll say that for most of my patients, they're not experiencing them, but it's a case-by-case basis. And you do have some of the patients who might experience some of the unpleasant side effects. But when you're dealing with the medication, it's important that they give you every possible side effect, okay? It is the moral obligation and legal obligation that you know all the side effects. But oftentimes they'll tell you what % of people in the study actually had those side effects. And a lot of times it might be 0.003% of people had this side effect, 0.01% had that side effect. And in those cases, oftentimes the benefits of the drug will outweigh the risk. Again, most of my patients for whom I prescribe Farxiga are doing very well on the drug. And sometimes if it looks like the benefits outweigh the risk, oftentimes it may be a good idea, if your physician thinks it's right for you, to try the drug, check back in with your physician in a couple weeks or a month, go through a side effect profile, side effect check, lab check to see if the drug is working for you or if the side effects are occurring. If so, stopping the drug is always an option. But I would have a really detailed conversation about the fears. And again, look at the percentage of people in the study who got the side effects and figure out if the benefits outweigh the risks. But I will tell you, Farxiga is a drug that I do prescribe in patients when I feel it's indicated.
All right. Thank you, Miss Renita. Sharon Page.
Hi, Miss Sharon.
Is metformin bad for your kidneys?
Oh, metformin. Metformin is one of these drugs that many people are prescribed, yes, for diabetes, but even if they're pre-diabetic or if they have the PCOS. Ooh, Shador, who is that singer, that beautiful young singer who came out with her diagnosis of
I can't call
PCOS.
her name, but she sings that song.
Put that on my own mama.
Yeah.
Is that all right? Someone in the chat is going to know. Victoria Nunn. Not making up stuff. If anybody knows, that's not it. Olivia Nunn. Shoot, Shador. It's on the tip of my tongue. But anyway, but some patients with PCOS, metformin may be prescribed. And so it has its place. It can help decrease the hemoglobin A1C. It can help to manage diabetes. It can help to correct prediabetes before people even get diabetes. And in some patients, it can help to lose weight. It can cause kind of some stomach effects like gastrointestinal problems, make people use the restroom, make their stomach hurt, make their stomachs hurt. But the side benefit of that side effect is that can often help them to lose weight. And if they decrease specifically belly fat, abdominal obesity, visceral obesity, then having the lower belly fat can improve your sensitivity to insulin, and it can help with the diabetes. All of that being said, some studies show that if you do have kidney disease and your kidney disease, your EGFR, so if you have your MyChart or your labs and you look at your EGFR, if it is less than 60, then it is recommended, or some studies show that it can actually cause an issue with the kidneys, okay? If that EGFR is less than 60, okay? Then that's something that you want to discuss with your physician. But it's not one of those drugs where I say, oh, don't take it, never take it. It's going to cause kidney failure. No, that's not the case. But if your kidney disease has progressed to CKD3 or worse, it's a conversation to have and to weigh the pros and the cons on if the benefits outweigh the risks for you. That's a good question. Thank you.
Thank you, Sharon. All right, next question from Kalinda.
Hi, Kalinda.
Is pink Himalayan salt a good substitute for salt?
Ooh, that's one of my favorite questions because I have a lot of patients who come in. I'll be like, are you a salt shaker? Do you use a lot of salt? Don't use salt. I'll be like the salt patrol in my office, y'all. And they'll be like, nah, I don't use salt. I use pink Himalayan salt. Or no, I don't use salt. I use sea salt. Well, here is the key. Here's the key, Kalinda. I don't know how to say it. Kalinda? Am I saying it right?
Kalinda, Kalynda.
I wonder if it's Kalinda. Listen, put a thumbs up if Kalinda is right. Okay, so Kalinda, give me a she give me a thumbs up. Okay, put a Kalinda.
Yes.
I get obsessed over names. Mama said there's nothing sweeter than the sound of your own name. But anyway, so here's the key. I want you to look at the sodium in the pink Himalayan salt. So pink Himalayan salt does have more minerals and it does have more minerals and is less processed and can be, have health benefits in that manner. But the key is that it still has sodium. It still has sodium. And in a lot of ways, the sodium that it has, it's comparable to that table salt sodium. So in short, it's still salt. Sodium is sodium is sodium. And according to the American Heart Association, it's recommended that most adults have less than 1,500 milligrams of sodium a day. So whether it's sea salt, pink Himalayan salt, or just your regular table salt, it's still salt. And so it's not a great substitute for sodium. There are some things like Mrs. Dash or other just blends that have a lot of herbs, garlic, herbs, peppers, things of that nature. Those are going to be the better substitutes. But pink Himalayan salt still has the sodium. And so it's not a great substitute for salt. It's still salt.
All right. Thank you. Now, if we may give you your flowers and we'll.
Oh, yeah. I like flowers.
Tonight. All right. We'll start with Miss Rosalind.
Hi, Miss Rosalind.
This is what I love about you, Dr. Frita, your approach and love behind your explaining solutions.
Thank you. I appreciate that. Oh, that's nice flowers. And it's not even Mother's Day.
It's right around the corner.
Child, look, I didn't get my mom anything. Look, I gave my mama, Dr. Inez, a shout out. Don't tell. I hope she's not watching. I ain't give her any good thing yet. Anyway, hi, Mama.
Yeah,
All right.
All right.
Miss
Jetty.
Hi, Miss Jetty.
She says, excellent explanation of arthritis. Your bone definition really allows a lay person to understand, Dr. Frita.
Thank you. Y'all, Jetty is my sister. But I didn't pay her. Thank you.
Not a paid promotion, so to speak. Miss Deborah Davis.
Look, and Jetty's painfully honest anyway. She don't give fake compliments. Trust. Thank you, Jetty.
Miss Deborah.
Nasty. Hi, Miss Deborah.
Dr. Frita has great videos on what to prevent and what one can do.
Thank you. I appreciate it.
Then we have Miss Pat D. Dr. Frita, I've been very obedient with all your information for a very long time. I send your message all the way from the Caribbean.
Oh, yay. Oh, I need to go to the Caribbean. Oh, goodness. Thank you. Ooh, I appreciate the international support.
And she says your mom did a good job.
Oh, thank you. Okay, now I do hope she's watching. Mom, are you watching? Thank you. I appreciate that.
And
Thank
we
you.
have Ronnie. We love seeing you on TV representing us, Dr. Frita.
Oh, thank you, Ronnie. Thank you. Oh, yeah, for that clip that I just did, I will be posting that. So if you make sure you're on my email list, we'll make sure we'll put a link in the description on how to get on my email list. And that way, when I post different things, when I have speaking engagements coming up, when I'm going to be on news shows, when they give me some type of a lead time, then you'll know, so you can catch some things live. Thank you. I appreciate that, Ronnie.
All right, Dr. Frita.
All right. Has it come to an end, Shador?
It come to an end.
All right. I thank you, everyone who's been in here. Thank you, Shador, for always doing such a wonderful job co-hosting, getting these comments in. I thank you to everyone who's in the chat, who's here to support. On your way out the door, please be sure to like this video, subscribe to my channel, hit that notification button so you'll be among the first to know when I release new videos. And, just look in the link for the link in the description for some of the things that we talked about. Like if you want to get some help with your blood pressure, understanding how to have the integrative approach, make sure you order my book on Amazon, check out the link. Also, if you want to have a more one-on-one discussion with me where I can actually get more of your history, some more personal details about you to give you some one-on-one information, then I do offer a concierge telehealth service where I can talk to you. So we'll have that link in the description as well, where we can be one-on-one and I really can give you some more specific medical information in more detail, more time. We can have a talk that way. Well, come on back with us. We'll be here next Monday, same bat time, same bat place for our Medical Monday, Medicine in the News, talking about all the hot health topics. Thank you so much for your support. Thank you, Shador.
You're
and
welcome.
Hey, we'll see you next go around.
All right. See you later.